I'm not able to go for any social functions. My friends are going for a picnic tomorrow and I have said no, though I used to love going for a picnic. I'm scared of the Diwali firecrackers. I'm scared when there's a loud noise. These could be symptoms of PTSD, post-traumatic stress disorder. Hi, I'm Dr. Leonora, and today I want to talk to you briefly about what is PTSD. It could affect people who are in the war zones, the military personnel who see death and horrific scenes every day of their life while they are in the frontiers. Then it could affect people who have experienced serious accidents. It could affect those who have undergone sexual assaults. It also affects them, and childhood abuse, and of course, natural disasters like earthquakes and floods. So these are the people who get affected by PTSD. So now, it's a very generalized thing I'm going to talk to you about. What could be the symptoms of PTSD? Some of the common symptoms could be avoidance. Such people try to avoid situations, people who might be responsible for this trauma. It could all be in the form of flashbacks, nightmares, where a person relives these experiences. These nightmares generally happen at night. So they relive these experiences which they've gone through. It could be panic attacks. It could be anxiety. So all these are some of the symptoms in brief that can lead us to thinking it could be PTSD. Of course, proper tests and diagnosis has to be done before we can label a person saying he has a PTSD, a post-traumatic stress disorder. Now you'll say, what's the treatment? Treatment is group therapy, individual therapy, that is counseling, a healthy lifestyle where there's a lot of physical activity, and most important is support of the family and friends. And yes, once it's a PTSD is diagnosed, early intervention. Early intervention can actually heal this problem. So keeping this in mind, let's talk about present day situations, war. Yes? So we are facing a lot of wars in this world. So there's a lot of PTSD that's cropping up. So perhaps it would be interesting to try and talk about what could be the symptoms and the early diagnosis and how do we treat those things. So in my next video, which will be in YouTube, please subscribe to it and see how PTSD is rampant among war personnel, the military personnel. Thank you. Have a lovely day.